The big ugly bill will gut Apple Health here in Washington state. First, Apple Health is Medicaid. 80 hours of work per month will be required for ages 19 to 64 adults. Eligibility will be evaluated more often. The sign up window is shortened for everyone, and so much more. The human impacts of the bill. Here in Washington, at least 250,000 people will lose their Medicaid or Apple Health benefits. Another 150,000 will not be able to afford plans on the exchange due to the cuts. Before cuts, about 5% of people are uninsured. After cuts, that number will go to 10 or even more percent of people uninsured. This is a huge double increase. Washington is a huge loser in this bill, among the highest in the nation. The estimated cuts in Washington are 19%, according to the Kaiser Family Foundation. And it is bad in any state that participated in Medicaid expansion. There's actually stuff written into this bill to penalize Medicaid expansion states. Rural areas are going to be heavily affected. There is a rural health fund in this bill, but it is dwarfed by the reductions in Medicaid spending in these rural areas. In Washington state, our rural areas have significantly higher usage rates for Medicaid. Rural hospitals will close. According to Governor Ferguson, 31 rural hospitals are at risk of cutting programs, and another 18 rural hospitals are at risk of closure. In light of these cuts, we need to rethink healthcare. The cure for this is universal healthcare. Nationally, that means Medicare for all. In Washington, that means the Washington Health Trust. The Washington Health Trust is a trust with its own revenue stream. The fund would then pay all medical bills for Washington state residents. It is a true single-payer healthcare system. Universal healthcare would cost our state around 7% less while providing healthcare to 7% more people. And it can be passed via initiative or through the state legislature. All Washington state residents would receive comprehensive coverage of medical, dental, vision, hearing, mental health, and reproductive care. There will be no deductibles, no copays, no networks, no denials, no bills, and zero out-of-pocket spending. Want to have universal health care? Check us out at wholewashington.org.